three components. The first is the Combi guide, which is a bone reduction guide and osteotomy guide all in one. But it also features a pre-planned fiducial marker, which we'll teach you about. The second component is the scan guide, which is a masking scannable platform that allows a very smooth capture of the items needed to complete a photogrammetry case. And then a fast design service. So if you have a predictable fiducial marker and you have a simplified way of capturing just the simple records that you need, the fast design service is always available in 30 minutes or less, typically less. So this is a very exciting product for the digital workflow for full arch. So the problem statement is, why did we create this system? Why did we create this service? Because there are quite a few issues with the current flow of grammetry and photogrammetry processes. And over the past couple of years, we've found workarounds, doctors have as well, in dealing with all the variables that happen during surgery and during capture, and then during the stacking and design of the prosthetics. You know, one of them is fiducial marker variables, right? They are different shapes, sizes, manufacturers, materials. They're rarely consistent from case to case in position, but certainly in shape and form, right? It's not an exact science usually matching fiducial markers. They're randomly placed. Sure, consistent locations in the landmarks in a patient's mouth, but they're not consistently placed because they're in the ramus, dehameter notch, they're in the palate, they're in the labial vestibule, they're randomly placed, and then all these different designs, and then they can move during surgery if they're not anchored very well in bone or whatever the situation is. Even sometimes mobile teeth, they move. They fall out, you lose your reference, and that obviously causes a real problem. And then the problem of scanning all the way around the arch in a bloody field when the patient's moving or when there's blood moving or sutures or tissue flapping. It's tough for these intraoral scanners to capture all this. You know, this is just some of the issues that you'll see. Right, capturing a bloody environment, capturing stationary objects in the middle of a palate while trying to capture an entire arch of random surfaces, bloody moving surfaces, and then repeating surfaces. You know, scan bodies, suture caps, healing collars, repeated same shape items that confuses the scanner, and then to add in, you know, a couple of screws back in a retromolar pad, or 3 up there in the top left. You can see that image. You know, we're scanning a denture 360, you know, predictably, right? So there's all kinds of variables that we say can be overcome with this GuidedSMILE digital approach. You know, some scans seem to be easy, but you can't always tell if the scanner is ghosted, or to capture a bunch of scan bodies and then continue around to do a full arch and expect an iOS to stitch that. Lots of challenges. I mean, look at this case here. This was, you know, from a couple of years ago, but this is seen every day now. And just look at the fiducials, right? There's 2 remaining teeth. There's a fiducial marker in the palate, stable, predictable, but the scan itself. Imagine capturing all of this and then registering it back to the one on the right hand side. So many variables. Predictability is not certain here. So what we're offering is a simple scan. You scan a surface that is probably clean, maybe a little bit bloody, but probably clean. It has geometries on it that are non-repeating so that the scanner can simply flow from left to right. It has openings for either healing collars or scan bodies, or even flags from photogrammetry scanners. Anything that you protrude through there that can be scanned and then turned into a file, which Rowe Dental Laboratory is very adept at. Has a massive library of all these healing collars and scan bodies used in America. And this is a simple scan, a very easy, repeatable scan. These are scans captured by Dr. Fraunfelter, who helped us work through this whole process over the past summer. And you can see, if you recognize these shapes here, this is a micron mapper. So he does, it's one scan of an iOS, but then he does a quick micron mapper scanner for the dialing in of the accuracy of the implants. But the nice thing about our service is that we can recognize the shapes of the micron mapper as healing collar scan bodies with the intraoral scanner, just as you would, not to the same degree of accuracy, but just as you will with the micron mapper for photogrammetry. You don't have to change the item that you're putting on the multi-unit abutment. You iOS it, and then you micron mapper it, and then you upload it. And that is the only scan. Of course, these are 4 different cases, but these are one scan each, right? So this would be just one scan with an iOS, a micron mapper, and upload. And that comes to Rowe, and then we introduce it back into the stack that we designed it. Remember, we designed all these files at Rowe. This is a scan guide that you see here around the micron mapper scan bodies. All right, so that's just what we showed you here. It's a printed, very scannable material. The metal here is scannable, and so is this scan guide. So same thing here, one scan. Scan this, and if you're just using an intraoral scanner, then it's literally just one scan. You'll put a scan body in here. Any of the scan bodies on the market, especially the full arch ones, those are really suited better for multiple implants in a case, kind of like you see with here with their arch bridge scan body, a very accurate scan body, titanium, easy to scan left to right. And then once you have scanned the scan bodies, then you just continue around and scan the scan guide. Just seconds, scan the whole thing. And then you'll upload it. And, so here's the process. If you're not familiar with the Combi guide, the Combi guide is a delivery pinning guide. Delivers a fixation base. Fixation base holds the osteotomy guide to put the implants in and direct the rotation for the proper positioning of the MUAs. And then you put on the scan guide, which is basically a mask. If you read our article in Dentistry today, we spent a lot of time talking about how this is a mask to cover all of the blood, the moving tissue, the sutures, the irregular heights that happen in a surgery from extractions and bone grafting, that kind of thing. So it's not a predictable surface. So we mask it with the scan guide, and then you protrude the scan body through it, and then just perform a simple scan. All right, so in a lower, you're going to scan the scan bodies first, and with this particular system, you'll just go left to right, capturing the scan body, and then you just come around and capture the scan guide. And then you can even capture some of the fixation base to give us a nice 3-dimensional geometry, and then do the same for the upper, and that's what you upload. Simple process. And once we have the files, then we simply introduce them back into our stack, right? Register it back into the case that we designed, and then we'll make you a prosthesis, right? So pin guide, extraction, bone reduction guidance, and the whole time the fiducial marker is in the mouth. Basically the fixation base is the fiducial marker along with the scan guide. Implants, scan guide goes in. These are the anatomical features that are 3-dimensional, very easy to scan. And then there are many different things on the market that go onto an MUA that are either used for tissue scanning or for for stacking, right? So let's just say you're going to do an ICAM scan. So you put your ICAM scan bodies on the MUAs, you capture your ICAM. You can do that with or without the scan guide on. Then you'll come back and put your suture caps and then scan it again. That's it. These days we don't really need to have a sutured scan with the healing collars, because we know where your bone is reduced, right? We guided it, we planned it, we know where the bone is, and we just build in that gap. So we keep it real simple. And so while you're suturing, your team has already uploaded the files to us, and we are fabricating. Again, here's the arch bridge. The nice thing about the arch bridge is that it bridges all of the implants. Right, so you're not scanning a scan body and then dropping off and then coming to another one. That's all the same shape. Instead, these are all separate shapes, so your intraoral scanner never gets confused. So that's a very, very simple process. That's a patent pending full arch scan body. And once we have your scans, we just simply take one scan and then introduce it back and design your prosthesis. And then we bring it in, we marry it all together, right? And then introduce it back into our stack, design a prosthesis, and send it off to you. Our laboratory has completed thousands of these cases now, really a leader in the market. And we have a full team. It's all they do all day is design full arch restorations. And you'll just go to the website, look up Grammetry, Photogrammetry, book your case, book your surgical guide, book your Combi guide, and then book your day of surgery, which is a very, very easy to use bookings calendar on our website. And let us know in more than 48 hours before your surgery, and then you'll just simply drag and drop your one scan into the site, place your order, and then we'll have your file back to you within 30 minutes if you're using this technique. So what do you get from it? One scan technique, easy scans. You have a expedited service because the stacking is so efficient, and you get a quick return of your prosthesis. So contact us for any questions and start uploading today.